My mother was here in the long-term care in the nursing home from 1990 till about 1992, and she received extraordinarily good care here. I did a lot of research before I brought her here, and this was by far the best community to bring her. And that is a real important part of my decision, is what's going to happen to me after I'm not having fun anymore. It's nice to know and good to know that a facility like that and care like that is available. So I have a lot of confidence in the long-term care that I will receive here, based on past experience.
The decision point really was before my wife died last year. She was in the main facility at the village at Rockville, and she got excellent care, and I got a chance to meet the staff and really, find out what the village at Rockville was all about.
If you have a need for health things, they have everything covered pretty well. They have EMTs that come 24 hours a day. I speak from experience. I fell once and they come and you're taken care of right away, And there's the rehab that you can rehab after you've been in the hospital. All of that is a big plus because we can stay right here.
One of the first things and the most important thing for ourselves was we looked at the Maryland Medicare, or one of the evaluation forms. This was rated in, I think at that point, in the top 5. The other places we had to go to were not in the top 5. And that's important to us. Medical care is important to us, and access to medical care is critically important for us. And I saw the difference between what I would consider top-notch and what we actually felt with both my mom and my aunt by compromising.
As a continuing care retirement community, the village at Rockville offers everything from independent living to assisted living and long-term care. The typical progression is to go from an independent living environment to assisted living, and then finally we think about round-the-clock care or nursing care as the highest level. The model is really changing for how we can deliver that care, and particularly with the introduction of Glenmere, we anticipate that some individuals will choose to age in place in their apartments and receive some in-home care or in-home health. Others may choose to move to assisted living. It really gives individuals choice, which is really what we're about. There is no one-size-fits-all mentality with how we deliver care. In my years here, we've had some folks who have chosen to receive care in the cottages, and others have made transitions to assisted living. What this does is it really puts the ball in the court of the resident and gives us the opportunity as representatives of the organization to respond and serve in a way that supports the interests and needs of the family.